Hi, my name's Andrew. I'm an F1 doctor based in the East Midlands, and I'm currently on a clinical oncology rotation. I'm approaching the end of my F1 year, and I will next be moving into GP as part of my F2 training.
So I completed the stroke medicine rotation and I've started a clinical oncology rotation about 2 months ago. Both very interesting in their own rights, but also very niche and quite difficult at times because there's a lot of specialist knowledge required for both, which means that I've sometimes found myself outside my comfort zone and asking for help with a lot of specialist topics. What I've been enjoying about these specialties is that they are quite new to me. We have relatively little exposure to stroke medicine oncology compared to other specialties at medical school. So it's been very new subject matter, and I've been learning a lot of different things, exposure to a lot of different cases, and that lifelong love of learning means that it's quite fun to do. So one of the other challenges associated with this is that sometimes you can feel a little bit of an outsider at times because as doctors, you're rotating every 4 months. You're rotating to a new team, and some of those staff might have been there for years. You feel a little bit at the periphery sometimes, and you can encounter really good teams that can integrate you really well. And then you can also encounter teams that are less good at integrating you. And sometimes the emphasis is more on yourself and trying to make the most out of the experience and work within the team rather than work alongside the team. So there's a lot of challenges, trials and tribulations associated with settling into new teams. And I think that's where the advanced team communication skills course has really helped me because it's taught me a lot about what healthy teams look like. And as such, what are good behaviors within that team conducive to, ensuring good outcomes for patients, and also working well with others and enjoying working with others. And also, it taught me a lot about what dysfunctional teams look like. And I think as doctors or just anyone who works within a team, it's quite easy for us to identify what dysfunctional teams look like. But at times we might struggle to explain what makes a good team. So learning about both of those, that duality there, has really developed my understanding of how I can ensure I'm working well within the team, but also how I can support the team and support others with ensuring healthy teams and good outcomes for patients. I think that's one of the hardest things as a doctor, having to switch and move on to new teams every 4 months. It can be a source of a lot of stress, a lot of anxiety. And just as you're about to get comfortable with your current team, you're moving on to a new team and you're uprooted from that, effectively, that support system that you built around yourself, and you're thrown out into the wilds again, and you've got to start again from scratch. And I think what's really helped me with this course is that I feel a lot more comfortable with the idea of moving on to a new team, integrating as quickly and as effectively as possible. Also, any trials or any dramas that might be associated within the new team, I feel more comfortable with approaching them. Sometimes that involves having what could be considered difficult conversations or addressing potential points of conflict. And I feel a lot more comfortable with doing that as a result of this course, because from this course, I've learned how to approach these difficult conversations and also how to positively influence others. And various models that we've covered in this course and various frameworks and theories about like leadership, management, and communication have equipped me to be able to better approach these conversations and hopefully try to make the team work for you as best as possible, as well as you work for the team as best as possible. I've got my ARCP shortly and hoping to advance onto F2, and I'm really excited about moving on to my GP placement in F2 because it's going to be a very different dynamic to working within hospital medicine, and I've always enjoyed my GP placements throughout medical school. I've liked getting to understand and know patients a little bit better than maybe you might see them on a ward round, for example, in hospital. And I really like the different pace of community medicine. It has its own challenges, and I'm well aware of the the current atmosphere with surrounding GP training and practicing as a GP, but I'm still really excited about it, and it's something that I might consider for myself in the future.